Hello, my name is I'm a clinical psychologist, and today I'm going to talk about cognitive therapy, behavioral cognitive therapy. And this is a therapy technique that can be used for all psychological disorders, and my hope with this series of videos is that you will be able to use some of the principles to get a lot better. If you try these principles, they will work. They will make your life better, get you more in control of your feelings, and you might need to go to a therapist too, but you can get a long way by trying out these simple techniques. First of all, the basis for cognitive behavioral therapy is that the way we think influences the way we feel. You can have a very good day and then suddenly you get a phone call about an accident that has happened to one of your family members and you feel extremely bad. Okay, 2 minutes later you get another phone call with an excuse. No, there was a confusion of identity. It wasn't your family member who had been hurt. And whew, you feel very relieved. So nothing has happened in the outer world. It's just that you've been thinking that somebody you love has been hurt, and then you think that this somebody is safe after all. And your feelings go in the direction of the thoughts. So it is quite obvious that what we think about influences the way we feel. We don't react to the real world, what happens in the real world, but we react to what we think about the happenings in the real world. A very typical example is saying hello to a patient. As a psychologist, I'm not really allowed to say hello to a patient unless we have decided in advance that this is okay. I will in a way give away the patient if I say hello. Everybody will understand that this is one of my patients. So imagine a situation where I haven't discussed this with the patient, but I don't take the risk of saying hello. I meet the patient in a shopping mall, and to keep confidentiality, I just stare straight ahead and I don't say hello to the patient. If the patient doesn't know that I do this to protect his or her confidentiality, they can be very hurt. They can think, I'm just interested when I pay for my consultations. He's not really interested in me, etc., etc., and could have a devastating effect on their self-image. Whereas, imagine the patient that knows that this is the case, that psychologists are not allowed to say hello to their parents, to the patients, then this will be quite okay. It won't be a problem at all. Actually, one of my patients, she praised me for not saying hello. She said, "You were so professional." So the way she thought about the situation, the way she interpreted the situation, made all the difference. So, in other words, we can work with our thoughts. And when we can change our thoughts, the way we interpret what happens to us, then we change our feelings. And then the anxiety can go away and the depression goes away. So this is the first and basic lesson of cognitive therapy, is that it's the way you think about things that make you react to them, not the things in themselves. Okay, so now we're going to go on with several other videos about cognitive therapy, which are more of a practical nature, more techniques. The first technique I want to share with you is a very simple technique that will enable you to focus more on the positive things in your life. We have a natural tendency to focus on negative things, things that we can worry about. This is from evolution, in a way. Those who worried about having food for the winter, having shelter, having warm clothes, were the ones who survived. So worry is a bit built into us for our survival. But in our day and time, we really don't have to worry as much as we had to do in the Stone Ages. So what can we do to focus more on the positive and thereby worry a little bit less? Well, one very simple technique that I use with all my patients, and that becomes the favorite both of patients and other clinicians that I've trained, is called 3 good things. It has been investigated scientifically by, for instance, Martin Seligman, and they found out that this was the absolutely most efficient way of raising the mood of normal people and also of patients. And the technique is very simple. Write down every day at least 3 good things that have happened to you this day. It can be, I was able to mow the lawn, I made a good dinner for my family, I played games with my daughter, it was fun, I decided to watch a nice film together with my husband, etc. It's usually quite simple things, and what is extra good is if you find things that you actually started yourself. For instance, I went to visit a friend and it was very nice. It's also okay to take things like, I got a very nice phone call, it was nice to hear that she still cares about me. But try to find the things that you have actively done yourself, because then this becomes things that you can do in order to raise your own mood. And once I had a lot of patients, one after the other, and they'd all been home for the weekend, came back to the hospital, and asked them what they had done. And one had changed on the beds, the other one had dusted, the third one had washed 3 loads of clothes in the washing machine. And I asked them, okay, compared to the medications you take, how much upper did you get from doing practical things? And they were very convinced that doing practical things was very much more mood lifter than what I could get from medications. So when you write the 3 good things, try to write a few sentences about each. For instance, I played games with my daughter, it was fun to see her so enthusiastic, and now I feel like a really good mother. If you write these few things around it, you get even stronger effect from this. An idea to get it done can be to think that it's as important to brush my mind as to brush my teeth, so you do it after you brush your teeth every night. Couples may do this together and exchange the good things that they do, and in that way get to know each other better. Parents and children can do it together, and parents will then really discover what makes a good day for their kids, and this can be a surprise for many people. So you can do it individually or you can do it together with people. A very good technique, and write things down and keep them in a good book, in a nice diary. That's also an advice. Write every day 3 good things, write them in a nice diary, share them with the ones that you love. Good idea. Okay, another very good technique from cognitive behavioral therapy is to have a more critical attitude towards your negative thoughts. And you can do this with a very simple method that I call 1 negative, many positives. Here you try to put words to the thought that is really bothering you. For instance, a typical thing can be, I'm afraid I will never get better from this depression. Okay, you take a page like this and you divide it in the middle like this. On the left side you write the negative things, and on the right side you write the positive things. Actually you're supposed to write down only 1 negative thing, and then you counter it with as many positives as you can. For instance, if you wrote down, I'm afraid I will never get better from my depression, you try to find counter evidence, especially if you find concrete things that you can argue with, you can put that down. For instance, no, I had a very good day yesterday when we went to the beach with the family. Okay, I do a lot of the things that I have to do even if I'm depressed. I got very happy when I got a good result on my test the other day. Many people get out of their depression. research shows that people get out of their depression, etc., etc. The point is that you put down many positive things to counter the one negative. And on the positive side, you can put down also things that you put in your 3 good things technique. Doesn't matter, and I just put a lot of things on the positive side. If you're able to even find the positive in the negative, then you've really made it. More about that in the next video. As a part of focusing on the positive, which will lead to better mood and less anxiety, one of the techniques that I found most rewarding is to try to find the positive in the negative. And there are many big thinkers who say that within every adversity lies the seed of an equal or greater benefit. That means there's a silver lining to every cloud. When you have lemons, you can make great lemonade, etc., etc. There are many sayings in our proverbs about these things. So it's possible to find something positive in every negative thing that happens. Let me take a very simple example. One of my clients, a mother, she was so hopeless and so depressed about all the mess that her 20-year-old son was making in his room. She was complaining that she felt like she was his slave, that she had to clean up everything after him, what was going to happen to him later. He would never be able to have a house of his own since he was messing that much. She had a lot of negative thoughts around this. And I said, okay, now, instead of focusing on the negative, let's see if we can find the positive in this. She thought for a while and then she said, yeah, but he's actually very sociable, my son. The reason why he has so much mess in his room is that he always has friends over, and they eat a lot of things and they are enthusiastically engaged in what they do, so they don't have time to clear up. Actually, he's so enthusiastic about everything he does that he cannot waste time on clearing up in his room. The moment she was able to think about it like this, to see the positive in the negative, the problem was gone. And it is possible to do this on almost any negative thing that happens. There's always something positive in it. There's always a silver lining. This may sound naive, but it works miracles when you do it. And you might even take it as an intellectual challenge. It is better than Scrabble and Sudoku. Okay, use your brain to see what kind of positive things can be in each of the negative things that you experience. Okay, now we've talked a little bit about depression. Let's talk about anxiety. What are the techniques that are effective on anxiety? I work in an anxiety clinic, and one of the things that is very effective is exposure, gradual exposure. If you have become afraid of something, gradually exposing yourself to it, gradually getting closer to it, is the way to go. If you just do this very gradually, you'll be able to approach anything. The key word is gradual. Imagine that you have become afraid of going to shops. Okay, how could you gradually expose yourself to that? Okay, you can think of it like a staircase with very small steps. The first step could be just go close to the shop and stand outside and look into the shop for a while. Do this maybe 10, 15 times until you feel more used to doing that. Then you might just go inside the door, stand there for 1 minute or 2 minutes, and then go out again. Gradually you can increase the time that you stand there. After that you could try to go in and buy one thing and go out again. Or just go in to the shop, walk around a little bit and go out again if you're very afraid of the situation with the cashier, which many people are. Then you gradually increase it. I once had a patient who was very motivated for therapy, but suddenly she couldn't come. So I called her and said, well, why didn't you come? She said, no, suddenly I've become so afraid I can't get out of my house. I'm totally afraid of going out of the house. So I said, okay, But you think you could go just outside your door and stand there for a little while? Yeah, she could do that, okay, I say. Well, just stand there for 1 minute, then you increase to 2 minutes, 3 minutes, 4 minutes. So get used to that. And then you can start going out in the garden, 1 minute, 2 minutes, 3 minutes, 4 minutes. Then maybe you can go to your gate, and back and forth, maybe stay there a little bit longer. Then maybe you can go all the way to the mailboxes, check the mail, just go back and forth many times. Then you start going a little bit further on your street, a little bit further every time. Finally, maybe you can go all the way to the shop. And if you keep at this for a week, I think you'll be able to come to the next session. She did it, and she was able to come to the next session, and this thing about going out was never a problem anymore. So if you can just do things gradually, then with little by little, you will be able to approach the thing you're afraid of. But the key word is little by little. If you try to expose yourself to the worst thing you can imagine at once, you will probably fail, and it will attach itself as an even stronger fear. So the point is, the anxiety should just up to 50-60% of maximum level. Then you'll learn the best that this is not really dangerous and that you can master it. So gradual exposure is a very good way of getting over anxiety. Welcome back. Now I'm going to teach you a technique for anxiety treatment which is quite original, and you might think that this is too good to be true. It's not really going to work for you. Well, that's exactly how I felt about it the first time I read about it. I had a phobia for spider-like insects, we can call them spiders for simplicity, and I was very afraid of them, and I was training to become a psychologist and very frustrated that I hadn't been able to treat myself with everything I had learned. Then I read about this technique where it says you can treat your phobia in 5 minutes. Really? Is that really? No, I don't think so. No, I don't think so. But then I thought, how stupid can I be to not try to do this? If it takes only 5 minutes of my time, I'm going to try. Okay, so I read the instructions where it said, make an image of what you are afraid of. Then you start with the image right in front of you, and then you imagine that you send it out very far, all the way out to the horizon so that it disappears. Okay, the moment you've done that, you take a good picture of yourself, a success, being rid of this fear. You take that in. So out with a bad image, in with a good image, very quickly. The first times it will be a little bit like this, and then after a while you'll be able to do it faster. Okay, I did this. I looked at the spider, a little bit disgusting to look at, and then I imagined that I sent it out, and then took in this image of myself, being very proud that I've been able to do this. Okay. After that you take a little break, 10-15 seconds, just to clear your mind, and then again, spider, 1, 2, 3, yes. Okay, so I did it, and after 5 times I didn't feel any different. But then, when the season came and the spiders came, I said, wow, hey, I'm not afraid, wow. Then I thought, well, easy come, easy go, it probably just works one time and then I'll be just as afraid again. No. Then the next time the spider came, wow. And every time it became a wow. So I attached the wow to the spider. So every time I thought about the spider, I thought wow. So you can imagine this like the fear impulse starting in the image that you get in your brain, or what you think can happen, and then it goes into the anxiety center of the brain. I'm just going to draw a little bit here. Okay, here is the mind, and then it goes from the negative thought into the positive thought. You make this link. Because normally you'd go down to the anxiety center here and feel afraid. This would go out in the body and you would feel afraid. So you'd go this route every time you saw the spider before, but now after you have sent out the spider and taken in the positive here, smiling face, then you will go in this direction. So actually the spider will trigger the positive response instead of the anxiety response. This is how it works, and you probably won't believe it until you try it. So I would encourage anybody who has a fear of anything to try this. It's just your imagination that limits you. It's ideal to use for specific phobias for heights, spiders, water, dogs, things like that. But you can also use it for social anxiety. For instance, situations that you're afraid of. That people are going to stare at you, that people are not going to like you, and things like that. Just imagine the situation that you're afraid of. Out with that, and in with your, okay, you're mastering this. One thing that it works perfectly on is jealousy. With jealousy, we get strong feelings from the internal images or films that we make in our heads. So, when you're jealous, you typically have this film of a loved one that is involved with somebody else. Okay, you can take this film, send it out and in with a picture of yourself not being jealous, handling this thing in a very good way, actually working on your relationship. It can be good to build in something positive in picture, that you're working on the things that you're happy, but you're also working on doing things very positively. So, out with the bad, in with the good, then a break. Repeat 5 times. I'm going to do this on the next video. It's a session of fast visual reconditioning, also called the swish. Okay, we're now going to do one session of the so-called swish technique. And then I'm going to signal backwards like this, so that you send it from your face and beside me here. And then I'm going to do and then you take in the positive image of yourself mastering this. Okay, are you ready? Ready with the negative image right in front of you? 1, 2, 3. Positive image in. Okay, take a break, look around a little bit at the things around you. Okay, just so you don't attach the bad picture back in the good picture. Okay, ready with the negative picture? 1, 2, 3. Positive picture. Okay. I know it seems strange, I know it seems a bit weird, but just do the technique. I thought it didn't work, but it really worked. Okay, look around a bit. Are you ready? Clear with the negative image, and now we do it a little bit faster. 1, 2, 3. Yes. Okay. Usually people start laughing a little bit when they do this technique. It's a fun technique to do. Okay, just look around a little bit. Now we've done it 3 times. Ready with the negative picture. Now even a little bit faster. 1, 2, 3. Yeah. Positive image. Okay, now we've done it 4 times. And as you've seen, it's just a few minutes. Okay, less than 2 minutes actually. We've done it. Okay, you ready with the 5th time? Okay, ready with the negative image. 1, 2, 3. Yeah. Positive image. I can see on the video that I look a little bit strange when I do this. Doesn't matter if it helps you. It's a technique that is quite fun to do. It's great to do with children. Children who are afraid of insects or bacteria or all kinds of stuff that they can be afraid of. Okay, you can use this technique. It can even be used with trauma. If you have trauma images, you don't have to be a victim of them. You can send them out and take in a picture of yourself not being bothered by the trauma anymore. Being open-minded as a psychologist is a very good ability. And I haven't always been very open-minded. In 2004, a colleague told me about the technique that he said works on almost anything. All kinds of psychological things, and also on pain and even allergies. I became very skeptical. I said, no, not possible. There's nothing that works on everything like that. But I was curious. I asked him, well, what is this technique? What do you do? What do you have to do? I said, it's very, very simple, he said. You just have to tap on different places on your face, and then you have to roll your eyes and hum and count. I said, really? Psychologists don't do that. We have to stay a little bit professional. This sounds like really quacky stuff. No, it really works, he said. No, I don't want to have anything to do with this. And I forgot about the whole thing for 5 years, until 2009. Then I had been giving a course for a lot of people, and I had just taught them the so-called swish technique, which is a very fast reconditioning technique. And they were all very enthusiastic, and when we took a break, a woman came rolling up to me in her wheelchair. And she told me, you know what, you like these quick techniques, you have to learn the technique that I use to control my pain. I said, really? Control pain? And I would want to control pain because I had a lot of depressed people who were depressed exactly because of their pain. I said, okay, you have to tell me about that. What do you do? Well, you know, I have this technique. I just tap on different acupressure points on my face and on my hands, and the pain goes away. I had a little bit problem keeping a straight face because it was exactly the same technique that my colleague had told me 5 years earlier. So I said, wow, that's good, but what happens if you don't do it? Well, if I don't do it, I couldn't be here, she said. I would have to eat painkillers like candy, and I would be totally groggy. But now, if the pain comes now, I can control it. Because, you know, the reason why I'm sitting in a wheelchair is that I have hernia in my spinal column. So the nerves actually come out between the vertebrae, and it's extremely painful. Oh, so it sounds impressive. So I went and I checked out the technique. And I actually saw that they had done research on it, and that would be my reason for using a technique, is if I could know that it had been used in research. And it had been, and the research had been registered in the Cochrane database of controlled studies. And this is a very strong quality stamp. And what they had done it on was on phobias for small animals down in Australia. And they had found out that with this technique, they could treat the phobia 3 times faster and get results up to 80 or 90% of the patients. With standard cognitive therapy, it took 3 times as long, and they got 60 to 70% good results, which is quite impressive anyway, but it's nicer to be able to do it faster. So, okay, this technique seemed impressive. So I said, okay, but I have to try it for myself. And luckily I had a bit of pain, so I tried to define the pain as precisely as possible. And this is the point with the technique, the wording matters. So when I said just pain in my back, it didn't work. If I said burning pain right over my right hip in my back, burning pain right over my right hip in my back, burning pain right over my right hip in my back, then it worked. So you have to be specific. Okay. So I made it work on pain, and it was very impressive. I tried to rate the pain before it started, like it was on 6, and then on 1 round it was on 4, and 2, and then often 0. And this is very impressive when you can get your pain to go to 0. And you have to try to believe it. You probably think that I'm totally nuts believing in these things, but okay, try it and you'll see. But I hadn't tried it on psychological things, and after all I'm a psychologist, so I wanted to see if it worked on psychological things. I was a little bit apprehensive to try it on a patient directly, so I did it in a course where I had a woman who was extremely sensitive and very afraid of closed rooms. She couldn't sit behind a locked door. And everybody in the course knew that she couldn't sit behind a locked door because she would sit and hold the toilet door when she went to the toilet. And I said, okay, you want to try? Yeah, she was willing to try. So how would you say what you're afraid of in a very simple sentence? And she said, well, yeah, I think it's just I'm afraid of sitting behind locked doors. Okay, I said, we can try that. And then we did, afraid of sitting behind locked doors, afraid of sitting behind locked doors, afraid of sitting behind locked doors. Okay, and it took 1 minute with the rolling of the eyes of everything. I'm going to show you on the end of this video and on the next video. She went, I asked, you can't be cured with just that? She said, yeah, I think so. And I said, well, let's go and test it in the toilet that you have been just holding the door before. She said, and we went, everybody in the course went behind me. She went into the toilet, she closed the first door, locked it, then she went into the stall and she locked the stall also. I said, wow, impressive. Then she came out bright as sunlight with a bright smile. I said, yeah, no problem. And then I said, okay, but you had also phobia for being alone in an elevator. You want to try that? Yes, of course. So she said, afraid of being alone in an elevator, afraid of being alone in an elevator, afraid of being alone in an elevator. 1 minute, and she said, I think I'm over it. And we went to the elevator and she took the elevator alone for the first time in her life. Okay, 2 more short stories. Another one was with a woman who had extreme pain in her right arm. She hadn't been able to lift it higher than this. And it was a course with many participants, and I said, do you want to try to get it away? Yep, she said. And with the other hand, she defined the pain, aching pain in my right shoulder, aching pain in my right shoulder. We went through it once. It went from 8 out of 10 to 6 out of 10 on a pain scale. And then next one, it went to 4, then to 2, and then to 0.5. And I said, maybe you don't want to give up your pain, maybe you get some sympathy from it. No, we would try one more time, she said. Okay, we did one more time, and then she said the pain was 0. And I always get a little bit suspicious when people say the pain is 0. So I said, okay, but the proof is if you can now move your hand. And I said, don't push it if you feel pain, it's not good, don't push it. So, but just try to lift your hand. And she lifted her hand, and she said, oh my gosh, oh no, I can't believe it, this is fantastic. Oh, I would never have thought. And she lifted her hand completely without pain. Very impressive. So then I got really inspired. So when I asked the participants to try the technique on each other, then I saw one woman who was very stressed, just trying to explain it to a colleague. I said, you get stressed when you try to explain things to people? Yes, she said, it's my fear, I can't do these things. So then I said, oh well, great, then we can test the technique on you. Do you want to come in front and then we can test it on you? Okay, she said. And then I was a little bit too quick. I thought I knew what was her thing. So I said, okay, you're just going to knock on these points, and we'll see what happens. So you just say, I'm afraid of presenting things for others, I'm afraid of presenting things for others, afraid of presenting things for others. And when you say the fear, what you're afraid of. And I thought it would work. And it was on 6 out of 10 before we started, and when we were finished, it was still on 6 out of 10. Very embarrassing. So I suddenly remembered, no, but I didn't ask her what was her thought that triggered it. And I said, well, what are you actually afraid of? Dig a little bit deeper. What are you actually afraid of when you're going to present things? I'm so afraid I'm going to forget what I'm going to say. Aha, then we try to do it on that. Afraid I'm going to forget what I'm going to say. Afraid I'm going to forget what I'm going to say. Afraid I'm going to forget what I should say, etc. We went through the technique with that. And it went from 6 to 4, 4 to 2, and then 2 to 0 on the 3rd round. And I said, really, 0? You're not afraid at all anymore? Nope, she said. Okay, good for you. Then you can have a presentation about EFT, as it's called. And she stood up and she had a presentation in front of 25 people without hesitation. And at the end of the session, she just looked at her hands and she said, I'm not even sweating in my hands, I'm not even sweating in my hands. Because this was her typical symptom of anxiety. So the lesson to learn from that one is, if one thing doesn't work, try a different wording. And especially if you're going to do it on other people, ask them how they would say it. And this is the technique. I had a very strong demonstration of this with a patient who was very afraid that his heart would stop. So I thought that the thing that he should do on is afraid that my heart is going to stop. So we did, afraid my heart's going to stop, afraid my heart's going to stop. and it was on 7 out of 10 before we started, and it stayed on 7 out of 10. And I said, it seems like this didn't work. Can we try a different wording? I said, okay. So I said, but how would you express it? Yeah, it's an anticipation that the heart is going to stop. I'm not really afraid, but I think it's going to stop. Okay? So then I say, think my heart is going to stop. So we think my heart is going to stop, I think my heart is going to stop, I think my heart is going to stop. We went through it once, and it dropped from 7 to 3 out of 10. And I said, yeah, great, okay, now we got the right sentence, let's do it again. And then he forgot, and then he said, afraid my heart is going to stop, afraid my heart is going to stop. And it stayed on 3, it didn't move 1 inch. And then I said, no, but remember, you said this, the sentence that didn't work. Try again with, think my heart is going to stop. Think my heart is going to stop, think my heart is going to stop, think my heart is going to stop. And it went to 0. So the wording matters. Let me just go through it once at the end of this video, and then we take it again in the next video. First, you're going to say that you accept yourself even if you have the problem. So, even if I'm afraid of X, I accept myself completely. Even if I'm afraid of X, I accept myself completely. Even if I'm afraid of X, I accept myself completely. And then we go on the points. Eyebrows, even if I accept my X, so afraid of X. So afraid of X. So afraid of X. Under the nose, so afraid of X. Under the mouth, so afraid of X. Collarbone, so afraid of X. Under the arm, so afraid of X. Then the fingers, on the outside of the fingers, near the nails, so afraid of X. I'm 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 so afraid of X. And this one, I'm so afraid of X. And then it's the strange things. It's up here, between the ring finger and the little finger, and you tap like this, and then you close your eyes, open your eyes, then you look down to the right, you go down to the left, I do it opposite now so it's easier for you, and then you roll your eyes from the roof to the wall, down to the floor, up to the roof again, and then the other way, roll your eyes, and then comes the weird part. You're supposed to hum, so I hum Twinkle Twinkle Little Star, but just hum, don't say the words. Na, 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 na. Then you count to 5. 1, 2, 3, 4, 5. And then humming again. Na, 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 na. And then it's the same knocking sequence again. I'm so afraid of X. I'm so afraid of X. I'm so afraid of X. Tap lightly. So afraid of X. So afraid of X. So afraid of X. Under the arm, so afraid of X. Fingers, so afraid of X. 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 And so afraid of X. And there you've done 1 sequence. And very often the anxiety will drop like 2 points out of 10 for each time you do it. So you have to do it again. And you can do them one after the other. You don't have to take any break. It doesn't matter if you do it on the right side or the left side. Just follow the points. Okay, so you see it looks kind of weird, but it's a very interesting technique, and you can find heaps and heaps of videos on EFT on the web, on YouTube. Okay, so in the next video I'm just going to do the sequence so that you can do it by looking at the video. Okay, now we're going to do the emotional freedom technique sequence that can be used for any anxiety problem, any psychological problem. You can try it. Can't guarantee that it will work, but it's very short treatment, very easy to do, and if it works miracles. So you can use it on depression. One patient wrote to me and said that he just did this for his depression. So here we go with the technique. First, tap here on the karate point while you say, even if I have this anxiety, and you put in your anxiety, even if I'm afraid of spiders, I accept myself completely. Even if I'm afraid of spiders, I accept myself completely. Even if I'm afraid of spiders, I accept myself completely. I'm going to do this even if we have the noise, because you just turn down the sound and you do it. Okay. I'm so afraid of spiders, 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 I'm so afraid of spiders. Now just keep the fear of spiders back in the back of your mind and tap on this point. Close your eyes, open your eyes, look down to the right, look down to the left, roll your eyes, roof, wall, floor, wall, roof, and the other way, roof, wall, floor, wall, roof. Then hum, na 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 na. 1, 2, 3, 4, 5. Na 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 na. And the same. So afraid of spiders, so afraid of spiders, so afraid of spiders, spiders. So afraid of spiders, I'm so afraid of spiders, 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 I'm so afraid of spiders, so afraid of spiders, I'm so afraid of spiders. Finished. That's one sequence. Now you can rewind the video and do it again. Okay, now I will talk a little bit about trauma treatment with CBT. Many people have traumas of different kinds. Many things that seem like traumas to one person might not be a trauma for another person. Typical examples of trauma that could benefit in trauma treatment is anything that has been threatening the person in some kind of way. It could be an accident, it could be an attack, it could be any kind of abuse, somebody has abused you. It can be actually anything that has been experienced as very difficult. For instance, reading aloud in class and everybody laughing, being teased, being bullied, etc. So there are many things that can come in under the label of trauma treatment. Okay, the simplest way to treat trauma with CBT is actually as follows. Try to write down on a piece of paper everything that happened in as much detail as you can. That's the only instruction, actually. Try to write down what thoughts you had, what feelings you had, what actually happened. Try to put it in order. That's why it can be good to write it on a word processor on a computer. The point is to put things in order and to get them out of your head. Most people, when they've been in a traumatic situation, they have a tendency to want to tell it to somebody. This is natural, and this should be encouraged. Tell it to as many people as you can. This is probably a natural biological tendency that we have. Imagine that you've been almost killed by a bear in the woods in the Stone Age. You have to tell the tribe where it was, where you think the bear stays, what the bear smells like, what it looks like, how big it is, what it tried to do to you, how you escaped, etc. All these things are necessary for the other people to know in order to save the tribe from the bear. So it's quite logical that we have developed this intense urge to tell about the situation to people close to us when we have experienced something traumatic. That's probably also why it works very well to write down in the smallest detail what happened. The reason for this is probably that in both, like we have to tell it to the tribe, we also have to remember it for ourselves so that we don't get into the same problem again. And that may be why our brain flashes these things in front of our eyes from time to time in the form of what we call flashbacks. So when the brain feels that this has been recorded, that it is kept somewhere, that you can look back on it if you have to, then it doesn't have to keep it in memory all the time. That can be one of the reasons why this works. It seems like a technique that is too simple, but I have seen it have very good effects on many people. A woman who had been raped 3 times used 3 weeks, first week to write about the first rape, and then 1 week for each of the other rapes. And even if she didn't write much, she felt an extreme relief after she had done it. And she had been in different kinds of treatment before that hadn't worked. Just writing it down works very well for many people. The only problem can be that you feel bad while you're doing it. And to combat that, you can use what I've shown in other videos, the EFT treatment, so that while you're writing, you can tap on the points, or you can do it just on the finger points, where the finger points are on the upside of every finger near the nail. But you can do this by taking the finger under your thumb for each of the finger back and forth while you're doing the writing of the trauma history. If you write it manually, you can write it with 3 line spacing so that you can write in between when you remember more things. Try to write about what happened, your feelings, and especially your thoughts. Often it is your thoughts that will stay. For instance, one man had been very severely abused, and in the middle of the abuse he thought, I'm just a little shit. And this was what stayed with him for the next 40 years, this thought that he was just a little shit. And that's why it's important to get the thought, because once you've got the thought, then you can treat it with, for instance, the other technique, which was one negative, many positives. Write down, I'm just a little shit on one side, and then on the other side, all the arguments why you're not a little shit. Okay, so write down in the smallest detail everything you can remember from the trauma. Use EFT technique to keep yourself okay while you're doing it. You can take breaks if you feel that the anxiety goes over 3 or 4. You can take breaks and do the tapping. Okay, good luck. One particular kind of anxiety is called OCD, Obsessive Compulsive Disorder. It sounds like a very complicated disorder, but it's not really. It's the typical thing that people will check again and again whether they have got a cancer lump in any part of their body, if they've turned off the stove, if they locked the door. Some people get it about bacteria. They wash their hands a lot to get rid of bacteria. They cannot touch certain things. Other people have an obsession with order. They have to put order all the time. They have to put things symmetrically, etc. Other people have thoughts that they're bothered by, intrusive thoughts. For instance, people can suddenly start thinking that they might hurt somebody, that they might throw their baby off the bridge, they might slice their children with knives, etc., etc. So, how can we treat these problems? For the behaviors, it's what we call exposure and response prevention. That means that you try to expose yourself for what triggers your compulsion, for instance, washing hands, and then you try to limit what you do. For instance, a person who is afraid of getting dirty and washes the hands for 10 minutes can try very carefully to wash for 9 minutes, 8 minutes, 7 minutes, etc. I recently had a patient who checked for sickness and cancer every morning for 10 minutes. So I said, okay, put on your mobile phone for 9 minutes, and then you check as much as you want, and then later you check for 8 minutes, and as the days go by, you try 7, 6, 5. She's done this for 6 months, and now she's down to not checking at all. She was down to checking 1 minute every other day, and finally she was able to stop completely. Another young man was obsessed with putting order and used all his time to keep things clean and to put order. He was admitted, and while he was admitted, the nurse who was responsible for him got the instruction to go in and put a mess in his things as often as she could. And his duty was to try to not put order for as long as he could. 1 minute, maybe 5 minutes, 10 minutes. Finally, after 2 weeks, he was able to leave the whole thing for the whole night. And then it was as if the spell was broken. So, just reduce the actions that you do to relieve the anxiety little by little. When it comes to the intrusive thoughts, there are several things that you can do. The first thing is to know that it is the opposite of what you are. If you feel that you want to slice your children with a knife, that's absolutely the thing you don't want to do. All people can have stray thoughts like this, but it's the people who are often the most moral among us, the most loving, who will be extremely upset by these ideas, and then they get stuck. Then you try to push them out, and the more you try to push them out, the more they will be stuck. So, the first thing is to know that it's quite normal to have these thoughts. Everybody can have it. More than 51% admit to these kind of thoughts if they get to answer anonymously. So it's not dangerous, you're not going to do it, it's exactly the opposite of what you are. And you can actually use one of the other techniques, the reconditioning technique, the visual reconditioning technique, also called swish, where you take the image that you have, and you don't have to be afraid of it, so you just place it in front of you, and then you take control and send it out and take in the image of yourself as being okay, as not being bothered about this anymore. Very efficient method. But the most important is probably to know that these kind of so-called intrusive images are normal. That everybody has them from time to time, and that it's because you fight them so much that you get a problem with it. So, to sum up, do less of the thing that you do to reduce your anxiety, for instance washing hands. Little by little, if you're just patient and do it very gradually, you can get to zero relatively quickly. Okay, now we have come to what many people are most afraid of, the psychosis. Okay, what can we do when a person is psychotic? What can a psychotic person do to help himself? What can you do to help yourself if you have psychotic symptoms? Psychotic symptoms are often divided in two categories. One is hallucinations, where you hear things or see things that other people don't hear or see. The other category is called delusions. That means strange ideas that other people don't have. Often ideas that you're being followed, that you're being surveyed, or it can be ideas that you are going to be a fantastic writer one day, that you're going to marry a star, or things like that. First, about hallucinations. Hallucinations are not as uncommon as we might think. Hearing voices, which is the classical thing that people are most afraid of, that people often say is schizophrenia, means to hear voices, and voices are actually not that different from thoughts. If you ask people who hear voices what the voices say, they will often say things, you're too fat, you'll never make it. And this is exactly the same as depressed people think when they are depressed, just that they feel that they are thinking the thoughts themselves. Okay, so voices are often, in many cases, not more than thoughts that you could have had yourself, and like in obsessive compulsive disorders, thoughts can be intrusive. You don't want to have these thoughts, they just come by themselves. So you don't have to think about voices as anything more than thoughts. And you can argue against them just like you do with any negative thoughts. You can find counter-arguments, say no, I'm doing my homework, I'm doing my job, I can get better. Research shows that many people can get better, etc. That's what your voice is telling you. So both hearing voices and seeing things are much more common than what we think. Actually, around 5% of the population hears voices at any time. This was a study in Bergen that confirmed, in Bergen, Norway. That means that only 20% of these, 1% of the population, have problems with it. That means that 80% of those who hear voices actually have no problems with it. Many people will think of it as something nice, actually. People who are interested in spiritual things will often say that the voices are actually clear audience. It's things that I can hear that are messages from beyond, so to speak. Other people won't believe in this, but those who believe that it has a spiritual origin usually don't have any problems with it and can live very normal lives. Okay, later I will tell about a little technique that can take them away, if you want to take them away. With delusions, it's a little bit the same philosophy. People have believed different things at different times. In cultures different from ours, they believe things that are very strange to us. So we don't have to be so obsessed with taking away these ideas. Okay, people can have them and they can live very well with them. What is frustrating for a person who's got a very strong idea is if nobody wants to listen. If nobody believes you, then you can be very stressed about it. So rather, see what you can accept, try to accept what the person is saying, and very carefully you might argue against it with good arguments, but very carefully, very gradually. Don't say that, no, what kind of nonsense is that? For instance, a person who has religious delusions, if you are in the same religion, you might very carefully use arguments from within the religion. One patient that I had was very afraid of spirits, and in his religion they believed that God was much stronger than the spirits. So I said, but if you pray to God, if you believe in God, that He can relieve you from the spirits, don't you think it will happen? And he was very grateful. He said he had not thought about that. He just thought that he was cursed, that all these spirits were after him. He didn't think that he could ask for God's help. Okay. It's a way of, anyway, convincing the person from within his belief system. So, with delusions, also normalize, say that people believe strange things all the time. And the things we believe today are not the same things that we believed yesterday. So beliefs change, and have a relaxed attitude towards it. Okay, here's one technique that can be used for voices. Voices can be very bothersome sometimes, and especially if it is so-called imperative hallucinations. That means that people are experiencing voices that tell them to do certain things. I had one patient who had about the worst that you can get, a voice that told her to kill herself. Go and hang yourself, you swine, said a very nasty male voice in her head. She was totally devastated and said, maybe I should just do it. So I can stop this voice, maybe I should just do it. And then we devised a way that she could practice that actually got rid of the voice within a few days. I instructed her to imitate the voice in her head, saying exactly the same thing. Go and hang yourself, you swine. And then she said very suddenly, stop. No, I'm going to live. Okay, so she practiced doing this sequence. Go and hang yourself, you swine. No, I'm going to live. Then a short break, just like the visual technique. And then again, go and hang yourself, you swine. Stop. I'm going to live. Break. Go and hang yourself, you swine. No, I'm going to live. You can say stop or no in between. Actually, she did this. I instructed it for her to do this at least 50 times per day. And within 3 days, the hallucinations were gone. So this can be one way of doing it. Anyway, take control of it. Don't be afraid of these voices. They are just like very audible thoughts. Thoughts that are very easy to hear. And in many ways, we all hear our own thoughts. It's just that they don't seem as real as for people who feel that they hear voices. So, you can practice them away, and you can also know that it's quite normal to have these things for many people. And many people can live with it. You can watch a video with a woman called Eleanor Langdon, who had voices and who still has voices, but has got a much better relationship to this phenomenon in her head. Today I'm going to talk a little bit about a new treatment that is called metacognitive therapy. You might say that it's like a extension of cognitive therapy. The main point in metacognitive therapy is that we do not have to ruminate or worry. That we have learned through our upbringing, through our culture, that worry and rumination is good in a certain way. Imagine that you have a child who always thinks very thoroughly through everything that he or she does. This child will often be praised and say, "Oh, John is so good. He always thinks very thoroughly about what he's about to do. And when he has done something, he always thinks very much about if he did it right. He really reflects on things." Okay? In many ways, rumination and worry is seen as something positive. Parents who worry a lot about their children might feel that they're good parents because they worry, they really care. Whereas, in actual fact, the caring doesn't help the children at all. It actually makes the parents tired so that they might have less energy for the child. So the main point in metacognitive therapy is that worry and rumination is unnecessary. I have a very good saying, do something about it or drop it. If you are able to do something about it right here and now, for instance, if you are with your child and you're worried that the child is never going to learn to read, you can sit down and try to teach the child to read. But when you're away from the child, there's no point in worrying about whether the child will learn to read or not, because you're not in a position of doing anything with it, so the worries will just be in the air, in vain, so to speak. So, then comes the difficult part, how to not worry. If you first decide that, okay, worry has no point, it's just wearing me out, just making me pessimistic. If you worry about what's going to happen, you can just be very pessimistic. You're not really better prepared. If you sit and plan with pencil and paper about what you can do with things, okay, great. But apart from that, worrying is just going to make you tired and anxious. So, what can you do to stop worrying and stop ruminating? And the answer is, it sounds very simplistic, it is to think about something else. To think about or be engaged in something that's very important to you. We have this thing that we do all the time called detached mindfulness. You think about one thing, then you put that down and you think about another thing. Then you put that down and you think about a third thing. So we do this all the time. We think about something, then we stop thinking about it and start thinking about something else. So this is the point, this is the mechanism that all people have, that they can use all the time, is to put down the worry by starting to think of something else. Just make a thought experiment. If you sit and worry about your finances or about whether you were liked in the party that you went to, and then suddenly you get a phone call that one of your relatives is seriously injured and on the way to the hospital, would you still think about your original worry, or would your thoughts go more to the relative that is in problems? Of course, you would be spared from your own worries for a little while you're thinking about the other, more important thing. So, we have the ability to put it down when it's something extremely negative, but also something that is quite positive, that is something very important to you, has this power of putting down the worry because you need all your thinking capacity to think of the positive thing. A woman who was very worried about all kinds of things, once she was together with her husband and the children and had a very good time, she realized that she hadn't been worrying for several hours. Then the worries came back, but she had got the insight that, okay, she could get a free time from the worry by being very engaged in things that were very important to her. So in a nutshell, this is metacognitive therapy. Worry is in most cases unnecessary, but it is very rewarded by society in our culture. So you have to argue with yourself and say, no, this worry serves absolutely no purpose. I just get exhausted from it. And then say, I'm going to involve myself in something very positive. Instead, so that I will get energy and I will save my energy for if my children really need some help, for instance.